For more and more Virginians, it's getting harder to find vital health care services. And as pharmacy deserts continue to grow, lawmakers are looking to take action. Our Tyler Lane looks at what's causing these issues and what state officials are doing to address it.
It's dire.
Dire is how Sarah Abernathy describes access to health care in rural Brunswick, especially after her county lost its only pharmacy earlier this year. The closure more than doubling the distance to the closest drugstore where she and her husband have 11 prescriptions that need to be regularly filled.
I was angry because we were left with it's a 30-minute drive to South Hill or a 30-minute drive to Emporia.
That reality is apparently becoming more and more common across the Commonwealth.
The number of community pharmacies operating in Virginia has steadily declined in the last decade.
This week, lawmakers on the Joint Commission on Healthcare received a new report showing pharmacy deserts are expanding in Virginia. It's a problem that state officials declared a public health threat in October. The data shows 14% of the population now has limited or no access to a community pharmacy, which can have negative health outcomes like reduced medication adherence and lower vaccination rates.
You know, when you look at pharmacy and people taking their medications, it's actually most cost-effective way to keep a person healthy, keep away from a doctor's office. Pharmacists see more individuals and communicate with them more than any other health professional that's out there.
The report found that revenues are not keeping up with cost, a primary reason being that pharmacy benefit managers, or PBMs, are not reimbursing pharmacies enough money to cover the expenses of purchasing and dispensing drugs. Typically, a PBM serves as a middleman that works with an insurance plan to negotiate medication prices with manufacturers and then reimburses pharmacies. In some cases, a PBM, insurance company, and pharmacy may all be under common ownership.
We are negative on the majority of our medications.
As CBS 6 highlighted in a previous report, the owners of the Goochland pharmacy say that under this system, consistently low reimbursements threaten the viability of their business. I mean, is that just you have to eat that cost at that point?
That's you're either going to eat that cost or you're going to ultimately, unfortunately, have to turn the patient away.
While commission staff say right now it should cost about $13 to $14 for pharmacies to dispense a prescription, which is of course on top of the cost of getting the drug, Virginia pharmacists report the average dispensing fee they receive for Medicaid members ranges from pennies to $2.
Why would PBMs be reimbursing pennies so low? Is this profit seeking?
It's profits.
Commission staff suggested lawmakers could further regulate PBMs by mandating that they increase reimbursements to pharmacies, like some states have already done.
It should be fair. You should be able to open a business and make an honest living without the fear of losing money.
The commission ultimately adopted several policy recommendations, which include setting a reimbursement minimum not only for Medicaid members, but for insurance plans at large. Here at the General Assembly building, I'm Tyler Lane for CBS 6 News.
If you've got a story for Tyler, you can send him an email to tyler.lane@wtvr.com.